And now back to the cardiovascular system, the last topic, blood vessels. So here we go. Uh, Arteries are going to be the high pressure conduits of blood away from the heart, and veins are going to be the low pressure conduits of blood to the heart. And the capillaries are going to be the blood vessels that connect the two. So there we have our blood vessels. So I'm going to just use the aorta as an example. So the left ventricle is going to contract, push that blood into the aorta, the great artery of the body. That is that blood is then going to pass through smaller and smaller arteries called arterioles until we get to microscopic one-cell thick tubes called capillaries. And the capillaries are so small, and just having one layer of cells makes it ideal for the exchange of respiratory gases. So for example, the aorta is going to branch many times like a tree, and each branch gets smaller and smaller until you get down to the capillary, which should only be about 1 millimeter away from every body cell, so that oxygen and glucose can leave the capillary bed and be taken up by the cells of the body so that they can do cell respiration. Carbon dioxide gas and water are byproducts of cell respiration. So carbon dioxide and water are going to be the waste products. So they are going to be swept away into the venules that become larger and larger veins. They are a low pressure system, so that they are going to have to utilize valves, just like the heart does, to prevent backflow. And in addition, being low pressure, they are going to need pumps to get the blood back to the heart. And these skeletal muscle and respiratory muscle pumps are something I'll talk about in a minute. Now, layers. Blood vessels, be they arteries or veins, have 3 layers. You have the inner layer that is, the inner layer, or the tunica intima, which are what are called endothelial cells. They're a type of epithelial cells, but they're inside the body, so they're called endothelial cells. And they are the cells that face the blood that's flowing by. Then the middle layer, tunica media, is going to be where you're going to find your smooth muscles and your nerves. Smooth muscles become important in arteries, especially because they will allow the medulla's sympathetic nerves to innervate them. And because they are circular, smooth muscle, when they contract, the blood vessels are going to become smaller, and that will cause vasoconstriction. And if the sympathetic nerves fire less frequently, the smooth muscle will be able to relax. And again, being circular, relaxation means that the blood vessels get wider, and it's called vasodilation. So that's going to be very important in regulating blood flow, both arteries and veins, but it's more important in arteries because it's a higher pressure and it needs to be more carefully regulated. So again, veins are also going to have a tunica intima. Your one-cell endothelial cells is going to have a tunica media with smooth muscle and nerves, but not a lot. And then a tunica externa both have, and it's the protective outer connective tissue layer. The lumen of blood vessels is where you have blood flowing through the space. And then the capillaries are the one-cell thick endothelial cells, which allow for exchange of respiratory gases, nutrients, waste products, etc. And just as an aside, arteries and veins do not exchange respiratory gases or nutrients or manage waste products because they're too thick. There's too many layers. You've got the tunica intima, you've got the tunica media, you've got the tunica externa. There's just way too much. But capillaries are just the tunica intima, that's it. So it's really easy for things to diffuse from high to low concentration or high to low pressure at the level, at that microscopic level of the capillary and the body cells. All right, here's a pretty picture. So as you can see, you have a much thicker artery, and one of the thickest layer is going to be the muscle layer. That's your media layer. If you look at the tunica media here and the tunica media and the veins, obviously it's thicker than the other. I have to make sure about clicking here, folks. And then, so you have your high pressure, very big, very thick arteries, and they're going to branch until you get to your microscopic capillaries, and then they're one cell thick tubes that are going to exchange nutrients and get rid of waste products and sweep them away into the venules. And veins are also have all three layers, but the muscle layer is so thin. And you don't really need it to be thick because it's low pressure. Here are the valves right here. And as you can tell, the space of the lumen is larger than it is with the artery. So those are your three blood vessels and the layers. So artery, capillary, vein. From the heart, exchange back to the heart. Now we have a new concept, peripheral resistance, or the resistance to blood flow. How hard is the blood flowing through these blood vessels? And we tend to talk about the arteries. Why? They're thick, they're high pressure, and their job is to deliver the blood to the capillaries and the body cells. They're to deliver the oxygen, deliver the glucose, and get rid of the waste products. So regulating arteries is going to be incredibly important. You only have so much blood in the body, and you want the arteries to be able to direct where the blood is flowing. For example, if I just had Thanksgiving dinner, I would like to have the blood flowing a lot to my digestive tract and not so much to my skeletal muscles. That's why very often after Thanksgiving meal, people sit down and watch football. They don't get up and run a 10K. And it's not within the purview of this review course to go into that, but there is a borrowing from Peter to pay Paul type of situation. It's all pretty much regulated by arteries. And it's the peripheral resistance. So if I have a very dilated, very big artery, the resistance to blood flow is very small. If I suddenly snug that artery up and I start to constrict it and get that smooth muscle to really get that blood vessel very small in diameter, then you're going to have a vasoconstriction event, and that is going to increase peripheral resistance. It's going to be harder for that blood to flow. So peripheral resistance is what we call that, and that phenomenon tries to explain how easy it is for the blood to flow through the blood vessel. If the blood vessel is vasoconstricted, the peripheral resistance goes up, and it's harder. And if you have low peripheral resistance due to vasodilation, then blood flow is a lot easier through very large arteries. And then that's going to get us to how do you regulate this. So that's going to be right here. So peripheral resistance is controlled by sympathetic nerve firing. So your medulla gets the information and then starts to devise ways of solving problems. And if the medulla says, or if the medulla feels that certain arteries have to be constricted and increase the peripheral resistance, then the medulla will start to fire sympathetic nerves at a very high rate. And that high rate of sympathetic firing is going to increase the vasoconstriction of those blood vessels. They're going to constrict, peripheral resistance goes up. If, on the other hand, the medulla decides that it wants to back off on the firing of the sympathetics, then the smooth muscle can relax and that blood vessel can expand and get quite large, and that's vasodilation. So that's how the arteries are very much controlled as far as delivering a lot of blood to one area or the other, or responding to insults like hemorrhage. And then we get into arterial blood pressure. So when you put a cuff on and you have your sphygmomanometer and you then increase the pressure above the systolic pressure, blood will cease to flow, and then you slowly release the pressure until you get to a point where you no longer hear the blood flowing, and those are your systolic and diastolic readings of blood pressure. So you have your systolic blood pressure, that's going to be the highest pressure that the arteries are experiencing. So that's going to be, let's say, 120/80. That's going to be the 120 millimeters of mercury reading. Diastolic pressure is the lowest level of arterial pressure during a heart cycle, so that when you have the blood vessel relaxed and now there is a diastolic reading, and that's going to be, let's say, 120/80, that would be the 80. So that refers to the fact that that is going to be a blood vessel that is at rest versus a systolic reading where the blood vessels are highly pressurized. You have to maintain some pressure in even a very relaxed artery, otherwise it'll collapse. Other definitions that might crop up in the quiz. Pulse pressure is the difference between systolic and diastolic. And then we get to MAP, mean arterial pressure, or MAP. That is not a specific blood pressure, let's say, when you take a person's blood pressure in their arm, but it's trying to give you an idea of the average blood pressure everywhere in the body, and so that's the mean arterial pressure. We say that the mean arterial pressure, and I'm not doing math, no math, but it is a reflection of cardiac output and peripheral resistance. In other words, the mean arterial pressure is dependent on how the heart works. That's cardiac output, heart rate, stroke volume. That's the heart as a pump, and then peripheral resistance has to do with the arteries. Are the arteries, which are a conduit of blood away from the heart, doing their job to allow every cell in the body to have easy access to oxygen and glucose and easy removal of waste products? That is going to be the purview of the high pressure arteries. So it's the mean arterial pressure is the heart, the cardiac output, peripheral resistance, the arteries, and that is what gets regulated, what gets controlled, so that you can have every cell in the body, no matter what the high level of regulation or activity is, all those cells are going to have the ability of getting their oxygen and glucose and getting rid of their waste products. Okay, so next on the hit parade, veins. Now, veins are low pressure systems, and that has to do with the fact that as you have the arteries become arterioles and they branch and they get smaller, you lose a lot of pressure along the way. Now, you have enough pressure at the capillary to move the blood through, but you don't want to have the pressure that high. I'm not going to test you on this, but it comes down to the fact that you really want small molecules, respiratory gases, to go in and out. You don't want to lose any fluid. You don't want to lose any plasma. That is going to be a conversation when you have pathophysiology, but this is normal A&P. So you want to keep that pressure low, because the fluid would then start to go from high to low pressure if the pressure is too high. But then that becomes a problem for the veins. You don't have another little heart down there to pump it. So it's always a low pressure system because capillaries will feed their blood into veins, venules and veins. So what you have is a system of valves and a system of pumps to help move, especially below the heart. Because if you stand up, you have a lot of veins fighting their way against gravity from the legs, the torso, back to the vena cava, which will then return it to the right side of the heart. So these pumps, you've got a respiratory pump, you've got a muscular pump to help that blood go back to the heart. Let's do the muscular pump first because that's really what starts it all off. Between your skeletal muscles, you are going to have veins so that when you walk, run, move your body, then those muscles contract and they will then push that blood in the veins up. And then the valves shut and that prevents backflow. And then you have another muscular pump that will pump the blood further up and so forth and so on. Then you're going to get into that part of the chest cavity where it's larger veins. They're putting a lot of their blood and draining it into the vena cava. So you have to have an additional pressure because everything's much larger. And that's the role of the respiratory pump. It's breathing. I mean, that's the reason why breathing is important for oxygen and CO2. It's also important to get blood back to the right side of the heart. So when you take in a breath, you are pumping. You have to have the muscles between your ribs and your diaphragm contract. And these wonderful inhalations that go on all the time are going to act as a pump for the veins, which also weave their way in between the muscles and the respiratory pump cycle. And that is what is going to get that blood back to the right side of the heart. So between the skeletal muscle pump, the respiratory pump, and the valves in the veins, you get blood going, again, unidirectional back to the right side of the heart. Okay, here's a pretty picture. So here's two skeletal muscles. Here's your veins. They're trying to get the blood back up. Here's a valve. Here's a valve. So blood comes up. Muscles, excuse me, contract, push that blood up through the second set of valves. They will shut so you don't get backflow. And it goes on and on and on until you get the larger muscles in the respiratory tract. And then voila, you've got the vena cava, inferior and superior, draining into the right side of the heart. All right, so what is going to happen now is we want to look at kind of the larger picture of it all. You are definitely going to have veins that can do vasodilation, can do vasoconstriction, but as far as maintaining blood pressure, they're a minor player, not a major player. What venous return affects specifically and directly is stroke volume, because stroke volume is the amount of blood pumped out of the heart, and that reflects how much blood is returned to the heart. So veins return blood to the heart, and therefore how much gets returned by veins is going to be reflected by how much is pumped out. In a healthy heart, the amount that you pump in should equal the amount that you pump out. And whether that means a lot or a little blood flow back to the heart, that's going to affect stroke volume. It's not going to directly affect heart rate. It's not going to directly affect peripheral resistance. It's going to directly affect stroke volume because the amount pumped out should equal the amount pumped in. And that's the job of veins. The job of arteries is to move that blood as quickly as possible to the arterioles and get it down to the capillaries so that you can get that oxygen-rich blood glucose-rich blood to all the cells of the body so that they can do cell respiration and then take all of their metabolic waste products and put it into veins. Now, maintaining blood pressure, that is really arterial. You are obviously going to have the heart as part of the equation, peripheral resistance as part of the equation, and blood volume. So when you take patho, you can talk, or there'll be different types of pathologies, and one can be like a hemorrhage. Someone has lost a fair amount of blood, their blood volume, their blood pressure goes down, and then how can you get them back to homeostatic normal, etc., etc. So you have these the points where you can regulate. Either the medulla regulates, or there's some self-regulation, local regulation that goes on, but your mean arterial pressure has to be at homeostatic normal for the system to run seamlessly. So again, mean arterial pressure is cardiac output, the heart, that includes heart rate and stroke volume, and then the arteries, the peripheral resistance. Capillaries and veins tend not to have that big a role in the mean arterial pressure. They have a role in keeping you alive, but they don't have a role in being a big player in maintaining blood pressure. All right, neural controls. So how does the medulla know whether the blood pressure is up or the blood pressure is down? And that has a lot to do with sensory neurons that are near the heart and near the carotid arteries, and they are called baroreceptors. And baroreceptors 24/7 measure blood pressure at the aorta, at the carotid arteries, at the aorta in order to maintain systemic delivery, and the carotid arteries because the brain is so very, very important. So the type of feedback mechanism to regulate this that the medulla does is something called negative control feedback. So for example, if your heart rate goes up, you want to have feedback via the baroreceptors to the medulla, so the medulla will respond by lowering the heart rate back to homeostatic normal. Because the response of a high heart rate is to decrease the heart rate, that's what they mean by negative. Don't like the name negative feedback especially, so I like to think of it as a feedback mechanism that will give you the opposite response, but whatever works. So you have your neural controls, your baroreceptors always monitoring mean arterial pressure, always monitoring arterial pressure. So then if the blood pressure, for example, decreases, you want negative feedback. You want to have an increase in blood pressure to get back to homeostatic normal. So your baroreceptor, sorry, spelled wrong, is going to decrease its firing. That tells the medulla that it wants to do the opposite. It wants to increase heart rate, increase stroke volume, and increase peripheral resistance. So it could increase its sympathetic nerve firing to the heart. That would increase heart rate and stroke volume, and it would increase sympathetic nerve firing to the smooth muscle of the arteries, and that would cause vasoconstriction, which would increase peripheral resistance. If the opposite happens, if the blood pressure increases, the baroreceptor firing is going to increase. Tell the medulla that it wants to do the opposite. It wants to decrease heart rate, decrease stroke volume, decrease peripheral resistance to get you back to homeostatic normal. So it just does the opposite. So to decrease heart rate, decrease stroke volume, that's going to be the job of the parasympathetic vagus nerves and the pacemaker. The peripheral resistance part is going to be a decrease in the firing of the sympathetics to the smooth muscle of the arteries. Everybody relaxes, everybody expands, and the peripheral resistance goes down. So that's the typical regulatory feedback loop that happens with most organ systems, but especially the heart and the cardiovascular system. All right, so this is a reflex. Again, this might speak to you. I explained it just 2 seconds ago, but this can be another way of viewing it. This is supposed to be like homeostatic. If the blood pressure rises, then you're going to try to get the opposite to happen. So you want to bring down the heart rate, stroke volume, and peripheral resistance. If the blood pressure goes down, then you want the baroreceptors to have the medulla take that information and to increase heart rate and increase stroke volume and increase peripheral resistance. And that is what I explained, but in picture form. And that's it. So that is it for week 1. And once you've looked at the PowerPoints and you've listened to my lectures and you've taken your notes and you have everything out there, because the quizzes are open book. The first quiz, I'm only going to have 15 questions. It's the first time you've done it. Remember that I dropped the lowest quiz, and we'll do the sample quiz. And if you can't make it to Fridays or you already know the drill, then the sample one doesn't count for anything, so you can kind of cut your teeth on that. But for the first quiz, I've decided to do 15 rather than 20 questions. And that is where I would go next. I would have everything around me, and then you have 30 minutes to do the 15 questions. And then it's automatically corrected and it's put into the Moodle grade book. So away we go. I will see you for week 2 soon.